Afternoon, everyone. It's my pleasure to welcome you to the COVID-19 Vaccine What You Need to Know webinar presented by Purdue University and the IU School of Medicine, West Lafayette. My name is Angie Abbott, and I am the Assistant Dean for the Outreach Engagement in the College of Health and Human Sciences and the Associate Director of Purdue Extension. The College of Health and Human Sciences and Purdue Extension is happy to partner with the Purdue School of Nursing, the Purdue College of Pharmacy, and the IU School of Medicine in West Lafayette, and we look forward to answering your questions today about the COVID-19 vaccinations. Thanks to those of you that sent questions in advance of today's presentation. Many of those questions will be answered during our first 30 minutes of presentations. We will use the last 30 minutes to answer additional questions that were sent in advance, in addition to questions that you put in the chat box. We ask that you use the chat box today as a place to submit any questions that you might have. Today's webinar is being recorded, and the link will be shared on the webinar website later today. Now I would like to do a brief introduction of each of our panelists, although additional details can be found on the webinar website. First, we have Sienna Cooper. Sienna is an MD candidate at the IU School of Medicine, West Lafayette campus. She completed her bachelor's degree in pharmaceutical sciences at Purdue University College of Pharmacy, while also taking courses in the Doctorate of Pharmacy program. Dr. Nicole Noel is a community pharmacist and the director of the Purdue University Pharmacy. Upon graduation from Purdue University's College of Pharmacy, Doctor of Pharmacy program in 2008, she began her career in community pharmacy with Walgreens. From 2008 to 2012, Dr. Noel served as a pharmacy manager and market immunization trainer for Walgreens in both South Carolina and Indianapolis. In 2012, she returned to Purdue as a clinical pharmacist for the Medication Therapy Management Program at the newly formed Center for Healthy Living located on Purdue's West Lafayette campus. In July of 2013, she transitioned to her current role as the director of Purdue University Pharmacy. Eric Palmer is a clinical assistant professor with Purdue University School of Nursing, where he teaches community and public health nursing. He is a dual master's degree from the University of Phoenix in nursing and health administration. He obtained his bachelor's degree in nursing from Morningside College, and he's currently working on his PhD at Purdue University. Dr. Greg Loomis received his medical degree from Albany Medical School in New York and completed his residency training in neurological surgery at Albany Medical Center and Veterans Hospital. He practiced for 30 years in Evansville, Indiana, and is presently retired from surgery. Greg is an assistant professor in neurosurgery at the IU School of Medicine on Purdue's campus. Please join me in thanking each of our presenters for presenting today. Now I'm happy to turn it over to Sienna Cooper, who will get us started. Thanks, Sienna.
Thank you so much. Okay, good afternoon or good morning, I guess, wherever you're tuning in from. My name is Sienna Cooper, and I'm, like she said, I'm a medical student here in the West Lafayette campus. The very first time that we gave this presentation, we gave it for a veterans facility. I was a little bit concerned that some of their healthcare workers were hesitant on receiving the vaccine. So we put together some really good information for them and for the veterans, and we're very excited to share it and even more with you today. Go ahead. So we're just going to go over a little bit of the background information of COVID and of the vaccines. So COVID, as you can see, is the third leading cause of death right now in the 45 to 85 age group in the United States, just behind heart failure. And 1 in 9 deaths in Indiana, even in 2020, were caused by COVID-19. That is not related to COVID-19. That is, in fact, caused by COVID-19. Indiana is the 12th right now in the nation in COVID-19 deaths per 100,000. So we're not quite at the head of the pack, but we're still not doing as well as many other states are. And nearly 200 million United States residents at this point in time have already been vaccinated, and 2 million of those, actually over 2 million of those, it's gotten a little better since I made this presentation a few weeks ago. Over 2 million people in Indiana have been vaccinated. Go ahead. So this is a little bit of the history of COVID. I find that people sometimes think that COVID is a brand new virus that we haven't seen before. But in fact, COVID is something, and this particular strain of COVID is something that was categorized about 20 years ago in China for the first time. The SARS-CoV virus killed 800 people at that time, and the World Health Organization issued an alert that there was a problem with that. And so research went into understanding COVID and developing, treatments and possible vaccines from 2005 to 2016. The cases fell off a little bit during that time, and so funding was low. And we see very little research on COVID from 2016 until now, when the spike hit again, and we have this COVID-19 outbreak. Next slide. This is where the money came from. A lot of people are interested in, how did we get a vaccine out so quickly? This is a lot of what it was. The United States government passed the CARES Act on March 27th. We're getting just a little past that, to investigate new vaccines for COVID. And when you put a lot of money into something like that, things tend to turn out pretty quickly. So the FDA also, just a little bit after that time, released their guidelines on what the vaccine would have to look like in order to be used in the United States. They decided that they weren't going to allow any kind of difference in the kind of quality and the safety that we had ever seen in vaccines before, just because COVID was such a problem. The FDA wanted it to be at least 50% efficacious, which is on par with many of the vaccines that we have already. And they weren't going to allow companies to fudge on any of the standards of safety that they had required for previous vaccines. Next slide. So now we're going to talk about the 3 vaccines themselves. And for the sake of time, we didn't talk a lot in the presentation about how the actual vaccines work, the difference between the mRNA vaccines and the adenovirus vaccines, but we will cover those things in the question section. Right now, I'm just going to talk about the trials. So go ahead. So this was the Pfizer trial. You all know that the Pfizer vaccine was the first one that we had available in the United States. The Pfizer vaccine trial began in July of 2020, and it involved 40,000 people all over the age of 16. They didn't test it in children. They also didn't test it in healthy people, which was a really important part and something that they really strived for in this trial. The median age of the test participants was 52 years old, and 35% of those participants were obese, and 21% of them had pre-existing medical conditions. So they really wanted to make sure that within this 40,000 population, that they had a really good spread of elderly people and people who had pre-existing medical conditions. Next slide. So what they saw was that the Pfizer vaccine was 95% effective in preventing disease in people 16 years and older. The vaccine met all the safety requirements that the FDA required, and it was very, very efficacious in preventing COVID. And I'm going to show you a graph that's a little bit better representation of what that looks like. Next slide. So this graph shows us that the people who did not receive the COVID vaccine were much more likely to get COVID within the first 100 days after they began monitoring them than the vaccine group. So you can see the vaccine group is in pink, and we don't see nearly as many COVID cases in them as we see in the blue group, which was the unvaccinated group. Next slide, please. Now we're going to talk about the Moderna vaccine. This was the second one that we had on the market in the United States. The Moderna vaccine trial also began in July of 2020. The Moderna trial included 30,000 people instead of 40,000 people, but still very similar trials. This is a great deal more people than we have ever seen before in vaccination trials. 25% of these people were actually over the age of 65. The mean age again was 52 years old. And 17% of the people younger than 65 had pre-existing medical conditions. And the slide includes some of the medical conditions that they cited in their paper. Next slide, please. So the Moderna vaccine trial also showed that the Moderna vaccine was 94% efficacious in preventing COVID-19 in people 18 years and older. And this vaccine also met all of the requirements that the FDA put out in the beginning, that the vaccine was safe and that it didn't cause any concern for harm. Go ahead. And this is the same graph that I showed you earlier with the Pfizer vaccine. This is just the one from the Moderna trial. So you can see that the people who received the vaccine are in orange, and they got sick with COVID considerably less than the people who in the placebo group were monitored, which is in purple. Okay, and a lot of people are interested in why you need 2 injections. So the first injection of the mRNA vaccines primes your immune system like, oh no, there might be something here. It gives you about 50% protection after the first dose, 12 days after you receive the dose, not immediately, because it takes your body a little while to build up antibodies. If your body never sees the virus again, then the body knows that, well, that wasn't much of a problem. So instead of that, that's not what we want. We give another shot within those first couple of weeks so that the body really feels like this is something that we should protect you against. And that's the reason that we have to give 2 injections for the mRNA vaccines. Next slide, please. Okay, and this is the Janssen vaccine. This is the newest vaccine that we have seen. And so they just finished their phase 3 trial, and this vaccine's phase 3 trial was a little bit different. It included people from all over the world, which was different than the Pfizer and the Moderna vaccine trials. It included 44,000 people over the age of 18, and they were followed for 2 months, just like both of the other trials. The median age of the participants, again, was 52 years old, but 20% of these participants were over the age of 65. And this is a really good statistic because we know that people over the age of 65 are much more likely to have severe COVID. So these are the people that they wanted to include in the trial. Again, 40% in this group had pre-existing medical conditions. Some of them are listed below. And yeah, go ahead into the next slide. Okay. And these are the Janssen results. So the Janssen vaccine is a little bit less efficacious in preventing COVID altogether. It is 66% efficacious in preventing COVID. The interesting thing about this trial was that at the time that they ended the trial, this efficacy was continuing to improve. So it could very well just be that they ended the trial a little bit earlier than was needed to see that the vaccine is nearly or as efficacious as the other 2 vaccines. I believe that we will see more of this as more people get vaccinated. The vaccine is, however, 85% efficacious in preventing severe or critical COVID, including hospitalization, which is really the most important part of COVID, preventing COVID. Go ahead to the next slide. So I'm going to talk to you a little bit about vaccines that we already have for comparison here. Next slide. So these are vaccines that you guys are probably already familiar with. We know the Tdap vaccine and the chickenpox vaccine. And the Pfizer and the Moderna vaccine, as far as efficacious in preventing disease, sort of fall right in between those 2 vaccines. The Janssen vaccine falls a little bit lower than that in preventing severe disease, and just above the pneumonia vaccine, which we know is very, very efficacious in preventing pneumonia, especially in elderly people. And then you can also see the 2019 flu vaccine, not terribly efficacious, but it was still good enough for the FDA to approve that it was helpful more so than harmful. Next slide, please. Now we're going to talk about the safety and the side effects, which a lot of people I think are very interested in. Next slide. So this is sort of a list of the side effects that were seen among the age groups in the trials. So I guess that, you guys can sort of read this. I don't need to read these to you. But overall, the side effects were greater in people who were less than 55 years of age than they were in people who were greater than 55 years of age, which is a really good indicator for us that these side effects are caused by healthy immune systems. The side effects are a result of the immune system priming and reacting to the vaccine because younger people have stronger immune systems, and these side effects are not caused by the vaccines themselves. The side effects usually start within about 15 hours after receiving the vaccine, and they resolve in usually 2 days without any complications. Next slide, please. So now we're going to talk a little bit about the long-term effects. So as you know, as I've already told you, a great deal of people were studied during these trials for 2 months, and they have been followed up until now, and they have shown no adverse side effects related to the vaccines. Millions of Americans at this point in time, a little over 200 million, have been monitored by the CDC VSafe registry after vaccination, and no reported side effects have been attributed to the vaccines. Historically, most of the time, vaccines that we have seen in the past, if they do cause any severe side effects, this is seen within the first 2 months of receiving the vaccine. And the CDC and the FDA don't feel that there is any reason for anyone to be concerned about long-term adverse side effects for these vaccines. Next slide, please. So who are not recommended to get these vaccines? That's an important thing. Well, as of right now, people under the age of 16 and people under the age for Pfizer and people under the age of 18 for Moderna and Johnson & Johnson are not recommended to get this vaccine. Moderna is currently doing a trial in people under the age of 16 at this point, but it's not been completed, so they can't really give a recommendation on that yet. People who have had anaphylactic reactions to any vaccination before, or who are allergic to the ingredients in the vaccine, are also not recommended to get the vaccine, of course. And these are some of the ingredients that were included in the mRNA vaccines. I will add some links to the actual vaccine ingredient lists at the end of my presentation. But the vaccines contain no eggs, they contain no peanuts, no animal products, and no preservatives. Continue, please. Pregnancy is an important one. A lot of people are concerned that people who want to become pregnant or people who are already pregnant shouldn't receive the vaccine. So since the time that the VSafe registry began, a little over 30,000 pregnancies have been reported so people who were either pregnant when they got the vaccine or people who became pregnant soon after, within 2 months after receiving the vaccine. And so the CDC chose sort of a subset. They just sort of picked at random 1,800 pregnant women to follow all the way through their pregnancies after receiving the vaccine. And so here are the outcomes. What it has shown, in the same way that it has shown with all other adverse side effects, that the vaccinated group does not show more adverse side effects than the group of unvaccinated people. So even though we see things like miscarriages, we see on there that there have been gestational diabetes, and we see stillbirths on this list, it doesn't happen at a higher rate than it happens in people who were unvaccinated, which means that these things can't be attributed to the vaccine. It's just part of the normal background population rates. The same thing in all of the adverse side effects that we see for all of the vaccines. So at this point in time, the general consensus is that non-live vaccines are safe in pregnant women, and this includes both of the mRNA vaccines. Go ahead to the next slide. So here are your lists of everything that you need to know about the vaccines right now. These are the fact sheets that were released by the manufacturers about exactly what's in them, what's going to happen to you, how many people had, this specific side effect, and, if you shouldn't take it, what should you talk to your doctor about? These are all very wonderful fact sheets that will be included in the PowerPoint for you to visit. And go ahead to the next slide. Okay, thank you very much for being with us here today. I will go ahead and pass it on to Nicole.
Thank you, Sienna. So I just wanted to walk you guys through the logistics of receiving a COVID-19 vaccine. So next slide, please. So the vaccine supply currently in the state of Indiana, there's two sources. One of them is the Indiana State Department of Health, or they've rebranded it Indiana Department of Health. but they're the ones that are distributing vaccine to the county health departments, hospitals, and some community pharmacies. The Indiana Department of Health, if you guys have been following this throughout the last couple months, they're also the ones that determine eligibility for vaccinations. So if you remember, we started with healthcare professionals, those that have face-to-face interactions with patients. And then we started going by age group. So 80 and up, 75 and up, 70, et cetera. So that determination for eligibility of vaccination in our state was determined by the Indiana Department of Health. There's also a second source of vaccines that are being done through the federal retail pharmacy program. And as of March 10th, when we prepared these slides, in the state of Indiana, that included stores like Meijer, Kroger, Walmart, and Walgreens. So that list has since expanded a little bit, but that's the reason. So there's two different sources essentially of vaccine supply. Ultimately, all the vaccine supply is coming from the federal government, but it's being funneled through these two different channels. So next slide, please. So I wanted to talk a little bit, Sienna hit on this a little bit in terms of the vaccine schedule. There are 3 vaccines available that she talked about. The first 2, the Pfizer and the Moderna, are a 2-dose series. The difference is Pfizer is 2 doses separated by a minimum of 21 days or 3 weeks. And then Moderna is also 2 doses, but it is separated by a minimum period of 28 days or 4 weeks. With both Pfizer and Moderna, it is recommended that the maximum interval between doses be 42 days. So 21 days for Pfizer, 28 days for Moderna, and then the Johnson & Johnson, are also Janssen. It's sometimes referred to as Janssen, but also Johnson & Johnson is the same vaccine. It is a single dose. So 1 dose and you're fully vaccinated. So when you go and get your COVID vaccine from any site, regardless of whether it's a federal pharmacy partner or it's coming from a site that's being managed by the State Department of Health, you will receive, on the screen, there's a copy of it, you will receive a COVID vaccination record card. And it's really important that you keep that card, 1, for your own records, and you can show that you've gotten the vaccine. But 2, if you're getting an mRNA vaccination, either Pfizer or Moderna, it's important that you keep that card, because that is your record that shows which vaccine you received and the date that you received it, which would tell the time that you go in to get a second dose. It's going to be able to help the healthcare provider that's administering it confirm that you're within the recommended time and you're getting the same vaccine that you started with, because it is not recommended to switch from one vaccine to the other if you're doing a 2-dose series. If you start with Pfizer, you want to get your second dose of Pfizer. If you start with Moderna, you want to get your second dose of Moderna. So it's really important to keep that vaccination record card. I realize it's hard to keep track of a little piece of paper. So the other advice that I have is, once you get your record card, take a picture of it on your smartphone and save it. So that way, if you lose the little card 3 to 4 weeks later, you at least have a picture of it. And if worse comes to worse, in the state of Indiana, on the Indiana Department of Health website, specifically their COVID website, there is a way to look up your COVID-19 vaccination. So next slide, please. So how to schedule an appointment. In Indiana, there is a website dedicated to scheduling appointments for COVID vaccines specifically. If you've watched any of the news or seen any of the billboards, I'm sure you've heard this website before, but it is ourshot.in.gov. For those that need assistance or prefer a telephone, they can call 211, and those individuals will help our citizens get scheduled. So ourshot.in.gov will do it all electronically for you. But if you have a family member or if you yourself need assistance, you can call 211 and actually talk to a live person. And then the federal pharmacy partners, they may have their own websites for appointment scheduling and registration. So they will show up on ourshot.in.gov as sites that are open for anyone to schedule with. But they may indeed have individual separate websites for setting up appointments and getting the registration process going. Next slide, please. So what should you expect at the vaccination site? Typically, before you get there, if you do the ourshot.in.gov and you register with the state, you will do an electronic consent. You will provide the answers to the screening questions ahead of time, all done electronically. You will be asked to provide your insurance card. And we'll talk about that in just a minute. But once you get to the site, you will check in. And when you check in, that site is going to make sure that you've completed the registration process, you've given consent. They'll also likely do a COVID screening question, like, have you been exposed? Have you had a COVID test recently? Just to make sure that you aren't actively sick with COVID and receiving the vaccination. So again, all that stuff will just be reviewed. A lot of times, if you fill that out ahead of time, it can expedite your registration and immunization process. Most likely you will have your second appointment scheduled before you leave the vaccination site, if applicable. So remember, Johnson & Johnson is just one vaccine. You're not going to be asked to come back for a second time. If you get Pfizer or Moderna, you will likely have your second appointment scheduled before you leave the vaccination site. And it will be on that time frame, 3 weeks or 4 weeks, depending on which vaccine you receive. The other important thing to note that could be different from your other vaccination experiences is that there's an observation time. There is a mandatory wait time for COVID-19 vaccines. And what that means is post-vaccination, so after you've actually received your injection, you will be asked to sit and be under the observation of a healthcare provider. And really, this is just a safety mechanism so that if you're going to have a vaccine reaction, which typically occurs within the first 15 minutes, you are in the care of a healthcare provider that can help you, as opposed to driving down the road headed to wherever your next destination can be. So like I said, typically this is 15 minutes. It may be increased to 30 if you have a history of allergic reaction to a variety of things. So one of the questions that will get asked in your screening and check-in process is if you carry an EpiPen or if you have a history of allergic reaction. And that is simply a safety precaution that if you have some sort of allergic reaction history, regardless of what it is, they might ask you to stay for 30 minutes. It's not to inconvenience you. It is solely to make sure that, there is no vaccination reaction. Next slide, please. The other piece of information that you will likely be given, and if you aren't, you can still sign up for it, is VSafe. And Sienna talked about this briefly and gave some of the data that has been collected through VSafe. But VSafe is an after vaccination health checker. It is a CDC app. It's all smartphone based, and it uses text messaging and web surveys to check in on your health after you receive the COVID-19 vaccine. And so these are really simple. You'll get a text reminder that says it's time for your VSafe check-in. And they're at different scheduled intervals. They're more frequently at first, and then they get to weekly. And I think there's a few that are monthly afterwards. But like I said, it's voluntary, but you're providing that after vaccination information directly to the CDC, which helps post surveillance monitoring, things like that. So it's really simple. You simply click which side effects you're having, if any. It will ask you the severity of them, whether they're mild, moderate, or severe. If you needed to see a healthcare provider for any of your side effects, and if you missed work or you had to change your daily activities and things like that. So depending on your answers, someone from the CDC may call to check on you and get more information. And then VSafe, again, if you're getting a 2-dose series, they will also send you another reminder to get your second dose if you need one. So again, Moderna and Pfizer, you're going to get that second dose. Next slide, please. And one of the other things I wanted to touch on is cost and insurance billing. And so one of the most common concerns we see with vaccinations across the board, not just specifically COVID, but is how much is this going to cost? Because cost is a primary concern for a lot of people. And the good thing to know about the COVID-19 vaccine is that it is entirely free of charge for everyone, regardless of insurance, no insurance, under insurance, it doesn't matter. The COVID-19 vaccine was purchased by the federal government for our citizens and for people who are residing in the United States. So completely free of charge. What you may be asked to provide your insurance information, and that is because insurance will pay to the administering healthcare providers, whether it be a pharmacy or if you get your vaccine at a hospital site, they can bill private and public insurance for the administration fee. However, if you're uninsured or underinsured, in which they bill the administration fee and it's not covered 100% by your insurance, you will not receive a bill for that. They cannot charge you for an administration fee that was not covered by insurance for whatever reason. So there are some options for uninsured patients through the Health Resources and Services Administration Provider Relief Fund. But again, that you will not see a charge from a COVID-19 vaccine, regardless of whether it's for the vaccine or for the administration fee. So it's nice to know that cost is not a concern in this one. So next slide. And with that, I will turn this over to Eric Palmer to talk about what do we do now that we have the vaccines.
Thanks, Dr. Noel. So next slide, please. So we got the vaccines, we're going to get them. That's the first thing that you need to do, is to get the vaccine. And when I made the slide, it says when you're eligible. That was before the governor's announcement that everybody in Indiana above the age of 16 essentially is eligible to receive the vaccine now. Even after you get the vaccine, you want to make sure you still wear a mask. Maximum immunity, has been talked by Sienna and Nicole, is about 2 weeks after your last dose for the mRNA vaccines. And with the Johnson & Johnson / Janssen vaccine, you have a bit of immunity 2 weeks after, but they're showing that it increases a lot more even after 4 weeks, or up to 4 weeks after. Wash your hands frequently. This probably can't be stressed enough, but and this should be done regardless if we're having COVID or if we're having flu or whatever. Just wash your hands. Don't touch your eyes, your nose, your mouth without washing your hands first. And then maintain the social distancing guidelines when in your public areas, around others that are not in your bubble or your pod. Basically, these are the same things that we would recommend for flu season. And I'm hoping that because of this year-long COVID response that we've been going through, that when flu season does come around, that people feel more comfortable wearing a mask, and socially in the West, and especially in the United States. It's not something that we have typically done, but we can see that there's been a huge decrease in the amount of flu that happened during this last flu season because of these guidelines that we were following for COVID. So hopefully not as stringent, but hopefully people will feel more comfortable to do that socially. Next slide, please. So this is just a quick graph on showing how the vaccines have been working. We have the most data from the long-term care or the nursing homes because they were the first ones to get it in a controlled setting. And so you can see that there was a peak. The yellow line represents the amount of deaths, and the blue line represents the amount of cases. And then the two blue hash marks towards the right-hand side show when the vaccines were starting to be administered. And then you can see that there's this drop off after that. And so it looks like, the vaccines are working in those settings. Vaccines, there's more data out now that vaccines are working in real world settings, as they say as well. Next slide, please. Again, pretty much wear a mask. Even after the governor lifts his mandate on masks, I encourage you to seriously consider wearing a mask when you're not around those that have not been vaccinated, or when you're not around those that are in your pod or your little social bubble there. And this is from the CDC, and it just shows where counties where states required the mask or had the mask mandate, the cases of COVID-19 and the deaths related to COVID-19 slowed down. And then in counties where states allowed restaurants, dining, they opened it up. Then we had a speed up in the amount of cases and deaths related to COVID-19. Again, the vaccine is extremely important, but mask wearing has been shown to be really, really effective in decreasing the amount of cases. And so until we get to the point where everybody or the majority of people have had their opportunity to be vaccinated, really want to consider wearing a mask when you're in a public setting. Next slide, please. All right, I'm going to turn it back over to Dr. Abbott.
Thank you, Eric, and to all of our presenters. Now what I want to do is I want to remind people that we're recording this. All of the sources, all of the links, all of that information will be put on the webinar website for your viewing in the future. I do want to encourage you to if you haven't put your questions in the chat box, and we'll see if we can get to all of those. And we're also going to be getting to some of the questions that were sent in advance that we weren't able to answer during the presentation. So I am going to start with the first question that I have, which is, how long is it thought that the current COVID-19 vaccines will be good for? And so I'll hand that over to Dr. Loomis.
There we go. I think I'm unmuted now. Thank you for that question. That was great. And thank you all for attending. This is an extremely important webinar that we're having, and a lot of questions I'm sure will be generated afterwards, and please feel free to address them in our links. But we don't really know that for sure. What we do know is we have to go by what's called evidence-based medicine, and that simply means that the information that we have based on the scientific studies right now say that we really have to follow these directions. We can't, like Dr. Noel was saying, we can't mix these vaccinations. Maybe down the road we'll figure out that we can, but we can't do that right now, or we can't give one and wait to get everybody vaccinated with one and then come back and start doing the second one, because that's not what the scientific literature says. But right now we don't know. Some of the studies are saying 5 months. Some are saying 6, but I haven't heard any more than that. So right now we just have to go with the literature and say that the antibodies that are produced will last about 5 months to be on the safe side.
Thank you. The next question is, how will this vaccine protect me differently or longer than my own immunological response and defense to my post-COVID-19? Which one of you wants to take that?
I can answer this one, Angie. So part of the reason that the COVID vaccine is more efficacious than getting COVID yourself is that the immune system has a focus of injection where our body, after the injection site is injected, the body in that area makes a great deal of the spike protein, all in sort of this very small area, and the immune system can see that and recognizes that that is a bigger problem. When you have a systemic infection, there is a little bit less of that protein just by itself floating around for the immune system to react to. And that is one of the reasons that we believe that the COVID-19 vaccine is more efficacious in getting your body to have an immune response. The vaccine itself is also formulated in a way so that the immune system is more likely to recognize it and to attack it than it is to attack a regular virus. That's very strategic, and it's important in all vaccines that, that those things are implemented. The last thing is that these 2-dose regimens, and we don't have this for the Johnson & Johnson vaccine because its formulation is different, but the 2-dose regimens, like I said earlier, show the body in sort of short succession that this is a problem. And that is one of the ways that we know aggravates the immune system, especially to make lasting immunities. So when you see something one time, like a virus or a bacteria, the immune system's not as worried about it unless you see it multiple times. And when you see something, especially if you see it multiple times, the body builds up this very robust immune response to that because it sees it as a more serious threat. Does anyone have anything to add to that?
I would just like to add, in order for you to get natural immunity, you have to expose yourself to it. So my question to you is, do you really want to do that? While there's been, numerous studies that show that there are certain types of people with certain types of conditions that run higher risk of having a severe case or even possibly dying from it. There's been those cases in all age groups, unfortunately. Do you want to be, a special one to figure that out after you've gotten the virus? So in my opinion, it's much safer to go ahead and get the vaccine.
Thank you. We have another question that says, why should a young, healthy person get the vaccination?
I can answer that one. The more people that get the vaccination, the less it's likely that we're going to have less transmission. So, and we have seen cases where healthy individuals that have no underlying health conditions that are 20 years of age are ending up in our hospitals. We see evidence that 35-year-olds are ending up in hospitals and dying from this disease. So with no underlying health conditions. So the interesting thing about COVID is it doesn't follow a trend of, the older you are, the more health conditions that you have, more likely you are that you're going to end up in the hospital or suffering death. So COVID's kind of what I call a wild card. We don't know how it's going to interact based on our age or our health conditions. So it's important that everybody gets vaccinated, but it's likely that it's going to reduce transmission too. And so by getting vaccinated, you may not get real sick, but your parents or your friends or your siblings or your grandparents could get really sick from that. So does anybody else want to add to that answer?
No, I think that was excellent, Dr. Noel. The only thing I would add is that we hear about all these mutations that are coming in. And if the organism can't replicate, it can't mutate. So if it can't get into your body and produce more virus particles, it won't mutate. So part of the deal about keeping the B117 issue and all of the others, the South African and Brazilian, different subtypes of this virus from mutating is to vaccinate. So I can't even begin to stress how important that is. And a lot of the information that I'm hearing from people that are as a physician, the things I'm hearing from people are why they won't get vaccinated are coming from non-scientific sources. So it's important that information that you get from people that really don't know much about it, check it with the scientific sources. And the CDC has a great website with all sorts of scientific information about this virus and vaccines.
Dr. Loomis, I'm glad you brought that up, because one of the questions that we've gotten is if you can help us understand the terminology that's being thrown out, strain versus variant versus mutation. And you just mentioned mutation. So if you can help the audience understand those different words that we're hearing.
Sure, thank you. That's a great point. The strain of the virus is the type that's out there right now. For example, like the B117 is a strain, but it's a variant from the original COVID-19. In other words, we have, all of us look different. Some of us have blue eyes, brown eyes, tall. For example, my hair is thinning, Dr. Noel's isn't, but that's one of the problems of getting old. But we have all of these things and we look differently, but we're all kind of the same strain. The bacteria or the virus, they go through different transition periods. They adopt certain things that allow them to enter the body and reproduce. And they do that by changing their disguise so that the immune system won't recognize them. They put on a different disguise, and that disguise is called a mutation. And the only way that that disguise can happen is if the virus gets into your body and replicates. So if we prevent it, we recognize who the bank robber is, we recognize it, we can stop it from robbing another bank, but if it changes its appearance, we don't know who it is. So that's the way you want to recognize how these different strains, mutations happen. Does that kind of answer what you wanted to go, or does anybody want to add anything to that?
Thank you. The next one that I have is, do you know if there is a timeline goal for vaccination for children?
I can start and then I'll let anybody else add. So it was just announced that Pfizer has done studies in 12 to 15-year-olds and has shown promising results. Their next group of individuals is 5 to 11, and then the fourth group of individuals would be 2 to 4. The timeline on that they're hoping right now is to study those into the fall. So probably another 5 to 6 months to look for the same safety and efficacy data that we need for the 16-year-olds and up that are approved. So it are authorized for use. So it's coming. They know it's there, but the vaccine focused on those that are most vulnerable and that we have, adult data for. So does anybody else want to add to that? It's the latest timeline that I've heard.
Okay, thank you. Another question coming in is, I have read data that suggests that the spike protein that the vaccine trains your body to attack is the same protein that helps the placenta to attach to the womb. There is concern this vaccine could cause widespread infertility in women. Why is it not being researched or addressed before recommending women of childbearing age to get this vaccine?
I think I answered this question a little bit during my presentation, but the CDC has followed and shown that it doesn't cause any kind of problem in getting pregnant. Like I said, about 40,000, a little less than 40,000 pregnancies just before or just after receiving the COVID vaccine have been reported to the VSafe. And they have also shown that in women who were already pregnant or who got pregnant shortly after receiving the vaccine, didn't have any further risks than just the population rates that are always there for risks in pregnancy. I know that the spike protein itself is sort of similar to some of the other proteins in our body, and the placenta was one of the ones that was cited, but the data has shown that it doesn't actually cause any kind of immunological response to any other proteins in the body that would cause autoimmune reactions like the one that is described here in this question.
And Angie, I'll add to that a little bit related, but not exactly the question. There's been some new data that's come out too for these women that have been vaccinated during their pregnancy and have since delivered, that their babies are being born with antibodies to COVID. And so I think that's really promising, that although we don't have a vaccine for some of our most vulnerable tiny new babies, by getting vaccination, you are able to provide some immunity level to those very small, tiny, precious humans.
And I just want to add to what Dr. Noel said. The study was out of Mass General and MIT, where they looked, and it was reported just recently in the American Journal of Obstetrics and Gynecology. And they found that not only, as Dr. Noel said, did the baby that was born have antibodies, but the antibodies also pass through the breast milk. And they don't know what the sufficient titer is. And when I say titer, I mean the amount of antibodies you need to fight off an infection, but it is working. So it's extremely important. And one thing I want to point out about pregnancy, when we do these phase 3 trials, as the CDC recommends, there's a lot of women that participate in those studies that don't know they're pregnant yet. So we get the data after they find out the next month after they started the trial, oh my gosh, I'm pregnant. And that happened to a couple nurses that I know at IU Arnett here in West Lafayette, that after they received the first dose of the vaccine in December, found out in January, guess what? They were pregnant. So that's how we get a lot of these initial numbers. But these new numbers are showing that the antibody does pass through the breast milk.
So we're getting several questions related to people that contracted COVID-19, let's say in November or December, and they're wanting to know if they should get vaccinated.
This is a really good question. So the CDC at first was recommending that people wait their 3 months after getting COVID because those people were already protected. It wasn't so much that there's something wrong with getting vaccinated after you've had COVID, or you can't be vaccinated within your first 3 months of having COVID. That's not really the case. The case is more that they wanted to conserve vaccines there in the beginning for the people who weren't, hadn't already built up an innate immunity from having COVID. So I'm not sure what the is exactly on how many weeks you should really wait after receiving the COVID vaccine, or after having active COVID before you get the vaccine. But if you are past this sort of window that they originally recommended, then yes, you absolutely should receive the vaccine.
Yeah, and I think the data now shows that as long as you didn't get the serum or the the antibodies or the plasma, if you were in the hospital for severe COVID, in other words, if you just had tested positive and had COVID, there's no delay on getting the vaccine. The only delay that they're talking about now is if, like, for example, I'm over 60, if I was scheduled to get my shingles shot booster, I really should wait a couple weeks after I have that shot. Is that right, Dr. Noel? You're up on that better than I am.
Yes, yeah, and they do recommend separating the COVID vaccine 14 days on either side before or after any other vaccination. So that's really important. That's a good point to bring up, Dr. Loomis, because, you know, as 50-year-olds are eligible for shingles vaccine, which is a 2-dose series. So it's really important to think about as you're getting these other vaccines that you would get for routine healthcare. And if you're now eligible for the COVID vaccine, just think about the timing of that and making sure you're spacing them appropriately. And so it's 14 days either before your COVID vaccine or at the completion of your series if you're getting that 2-dose series. If it's just a single dose, it's 14 days before, 14 days after.
Thank you. Another good question that just came in is it safe for an unvaccinated child to hug or interact with an older vaccinated adult or grandparent?
Well, I have grandchildren, and we didn't see my grandchildren for about 4 or 5 months. And now that my wife and I have been fully vaccinated since January, we are very grateful that we can hug our grandchildren again. So my answer would be yes. If you're fully vaccinated, you're 2 to 4 weeks beyond your second shot, even though they say 2. If you're 2 to 4 weeks beyond your second shot and you have no symptoms, go for it. I know I did.
Thank you. We got a question. In places where there is a shortage of Pfizer and Moderna vaccine, the second dose is not scheduled until 4 months later. What is the existing data on the extended interval between vaccine dose?
Okay, that's an interesting question. I hadn't heard 4 months. I've heard some delays, but and the last I heard from the Indiana Department of Health is that the Pfizer vaccine is flowing in in large amounts right now. But the CDC currently says 42 days is the maximum time that you schedule your dose. However, there are extenuating circumstances like this, if we have supply shortages or we can't get appointments, et cetera. They recommend that you get it as soon as possible, but you do not need to restart the series. So that's the best data. And that's typical with all vaccinations. If you miss that second dose window, they don't recommend starting again. They recommend just completing the series as soon as you can. And so what you may be able to do is look outside your immediate geographic area and see if there is maybe one county over or the next town over, if maybe there's a little bit more flexibility in that schedule. And again, just make sure when you schedule your appointment, if you go outside of your original site, take your vaccination card with you so that they know exactly what you were given and when, so they can make sure you're getting the same vaccine and that it's within, at least 21 or 28 days period, depending on the vaccine you receive first.
Yeah, I think the most important thing that they have talked about is that you don't receive your vaccine too early. That is considerably more important than having any delays in receiving your vaccine afterwards, because if you receive your vaccine too early, you won't have as robust of a response to the second dose.
Dr. Noel or Professor Palmer, have you heard of anybody that's been delayed 4 months for their second vaccine? Because this is the first time I've heard, and I try to stay up on this the best I can, but I've not heard anybody having to go that long.
I've not heard of any delays. And another way that might be kind of around that is there are some sites that have sign-up lists for if they have like a dose left over at the end of the day. Not everybody makes their schedule for whatever reason. They may have a dose left over and they'll just start going through their list and calling people and say, hey, can you come in and get, the dose because it's, I've heard Dr. Loomis refer to it before as liquid gold. It really is. It's so important. And because of that, it's a precious commodity. But I have not heard of anybody having a delay of really anything more than a week or two past what the recommendation is.
Yeah, I haven't either, but we're also lucky in Tippecanoe County that we have 18 sites. And so like I said, if you are experiencing that, work with your local county health department, or you can call 211 and see. 211 should have visibility into those surrounding counties to see what sites might have capacity. So some of those more rural counties or that don't have as many sites as we do here, you may run into that, but I'd encourage you to be proactive and reach out to either your county health department and or the state at 211 to see if they can help you kind of see in the visibility that we can't see on the front end and the capacity at each site.
Thank you. We got a question, I think that was particularly from a Purdue student, but I think it's a question that could be asked by anybody. Will Purdue students or other individuals be able to schedule their second dose at the same time that they schedule their first dose?
Yes. So I happen to sit on our vaccine allocation task force here at Purdue, and Eric Palmer has been working with me on that too in terms of the planning, and we're getting ready to launch clinics very soon. But just like we encourage at all of our other sites, when you receive your first vaccination here at Purdue, your second appointment will be scheduled. If you are still going to be on campus at that point. If in the messaging will be, and this will go out to all students, I believe this afternoon or tomorrow, but it's coming, that if you are not going to be on campus at the time of your second dose, wherever you're going back home, whether that be somewhere in Indiana, California, Florida, wherever, get in touch with however they're taking appointments and get on a list for the appropriate vaccine. And again, taking your vaccination card with you or having a picture of it is going to be critical. But at Purdue's site specifically, I can say that second doses will be scheduled if you are planning to be in the area.
A question that goes along with that, Nicole, that maybe you can answer. It says, will Purdue prioritize international and out-of-state students due to eligibility being different between countries and states?
So the messaging that was sent very clearly from the Indiana Department of Health and our state health commissioner, Dr. Fox, was to prioritize all students at our site, even over faculty and staff. Students are to be number one priority because we realize that, the end of the semester is coming fast and we want to be able to get vaccinated, get as many people fully vaccinated as we can before you depart to home, summer internships, overseas, wherever you're headed. And so the plan right now is to move a significant number, I don't know if I should say this number publicly because I don't think it's been publicly released, but a significant number of appointments will be available every single day that the clinic is open. The clinic will will operate 7 days a week, and there should be plenty of appointment spots available. That clinic will run at least 10 hours a day, if not 12 hours to 14 hours that first week. So there will be a lot of appointments available. And so if you fall into one of those groups that you're going to be leaving campus, in the next few weeks and you're worried about your timing, as soon as that email gets sent out that you're eligible, sign up immediately. That is the best advice I can give you, but there will be plenty of appointments. I hope that answers your question. I can't release any information that hasn't been released by the university yet.
So more to come for Purdue students, right?
Yeah. Keep an eye on your emails. You will get more emailed information this end of this week into the early weekend.
Great. I think we have time for one more question. And this is a great one, I think, for all of you to answer. And that is, what is your best pitch to convince someone that does not believe COVID-19 is a serious health threat to take the vaccine?
I can tell you anecdotally, I used to work with this pharmacist and I've kept in touch with her. She is a 42-year-old woman who is extremely healthy, works out at the gym, cardio 3 times a week, and came down with COVID and almost lost her life. So vaccination was not available to her at the time. This was early December, but she ended up in the ICU on life support and needed a valve in her heart repaired. So, and she's like similar in age to me, works out 3 times a week. And her doctor said, had you not been so healthy, you would not have survived this. So, and I said this a little bit earlier, COVID is such a wild card. We don't know, it's not clear that, being young, 18 years old and healthy is going to be your ticket to getting through an illness. So I encourage everybody, regardless of what your health status is, to go ahead and get vaccinated. And you don't always know the health history of those that you're working with or those that you're interacting with. We may not know that someone's immunocompromised. And so by getting vaccinated yourself, you could be protecting those other individuals that you may not know are at higher risk. So
and let me just add one thing. I'll add one thing to that. Please look at the death toll. We're moving in on 600,000 people. And again, I can't even begin to stress with you enough to follow the science and don't pay attention to people that don't understand. Follow the science, but look at the death toll.
Thank you. Eric, you want to go ahead?
Yeah, I just wanted to add to that, on a grim note, that there's been a higher incidence of suicide amongst healthcare workers, and it's directly related to COVID-19. People go into healthcare to help other people, to help them get better. And what we're seeing is that the toll of the death toll of COVID-19 has weighed heavily on many, many frontline healthcare providers. There's been a huge increase in suicides of nurses and also physicians. And so something to maybe take into consideration if you're talking to somebody that doesn't believe that COVID-19 is a big deal. First, listen to them and understand them, because if you come at somebody with, guns blazing, you're not gonna be able to do anything to convince them. So just listen to them, understand where they're coming from, and provide them facts. As Dr. Loomis said, follow the science.
Sienna, do you want to add anything?
I think all of the things that you guys said were wonderful. But what I have seen, at least in my age group, is that for the most part, we want to get vaccinated. And I think that we want to get vaccinated because we have seen that there's very little risk. There just hasn't been the risks associated with receiving this vaccine, and there's a lot to gain. In January, one of my very best friends, who is 25 and healthy as a horse, she was sick for a month. And I don't want that. Nobody wants that. And when the vaccine is so safe and it doesn't have, a great deal of risk and it's free, why not? Why not be protected?
Great. Well, I want to thank each one of our panelists for their time in preparing for today and giving us great information and answering lots of our questions. I am so sorry I didn't get to all of your questions. An hour wasn't enough time for all the questions, but I do encourage you to check back to the webinar website for the resources and information that's posted up there, so that, and all of our contact information and stuff is there so that you can reach out to us as well. So with that, I want to thank you. We'll get the recorded version of this put up on the webinar website. Thank you all and have a great day.